Good evening. Good evening, all the members of Docplexus. First of all, I would like to express my thanks to Docplexus for giving me this opportunity to share my original scientific work, that is Vacuum Retraction Cannula for the management of atonic postpartum hemorrhage. Greetings from God's own country, Kerala. Here, I would like to remind you one Sanskrit sloka. Matru Deva Bhava, Pitru Deva Bhava, Acharya Deva Bhava. Mother is given first position and the most important position in the family. Maternal death creates a devastation in the family. Children become motherless. Maternal love and affection is lost. Husband may marry some other woman. The entire childhood of these unfortunate children become miserable most of the times. Coming to the magnitude of the problem, 287,000 maternal deaths were reported globally in the year 2010. Low-resource countries like Sub-Saharan Africa and South Asia contributed to 85% of maternal deaths. Our Indian contribution was 56,000 maternal deaths, amounting to 20% of the global burden. Maternal mortality should be considered as a national problem. All the governments should seriously consider bringing down the maternal mortality rates. Of late, maternal mortality rate in India is rapidly declining. This is because of certain schemes initiated by Government of India like Janani Sishu Suraksha Yojana and Rashtriya Swasthya Bhima Yojana, which are encouraging mothers to have institutional deliveries. 6,000 maternal deaths that occurred in India, postpartum hemorrhage was the leading cause, amounting to 30%. Majority of women died due to atonic postpartum hemorrhage. Then coming to how these maternal deaths are occurring. Maternal mortality due to hemorrhage is not the problem of higher medical centers because they have all the infrastructures like operation theater, blood components, and specialists. They can manage the problem very effectively. But in peripheral centers, where large number of deliveries occur under suboptimal facilities, majority of maternal deaths are occurring. Even though some risk factors like obstructed prolonged labor, accidental hemorrhage, and big babies are known to cause atonic PPH, it's not very clear why some women develop atonic PPH and why some women do not. For the same reason, this problem cannot be predictable. The only management strategy even today is watchful expectancy and act immediately whenever the problem arises. In low resource settings, the usual techniques available to control atonic postpartum hemorrhage include uterine massage, uterotonic drugs, and uterine packing and balloon tamponade. When these simpler techniques fail, techniques like Beeline suturing, stepwise devascularization, internal leg ligation, and uterine artery embolization are needed to control bleeding. But these techniques are available only at higher medical centers and not within the reach of every parturient woman. Unpredictable, sudden massive hemorrhage in low resource settings makes it difficult to organize competent manpower, compatible blood, and transport to higher medical centers. Many times, mothers die on roads while being transported to higher medical center due to hypovolemic shock. In some women, the speed with which the hemorrhage kills the mother is so rapid, the usually quoted first 1 to 2 hours as golden hours is missing. Sometimes, women succumb to death just within 1 to 1.5 hours after the onset of bleeding. The rapidity with which some women slip into coagulation failure and multi-organ dysfunction syndrome from hemorrhagic shock is alarming. Because of these complex reasons, the maternal mortality is not coming down in low resource settings. There's every need for a simpler and sure technique which can stop bleeding or at least stop bleeding temporarily to buy some time to tide over the crisis. This is the vacuum retraction cannula that I have developed. Measures 25 centimeters long and 12 millimeter in diameter. Fundal portion is having larger longitudinal holes, and cervical portion is having smaller and round holes. There's uterine angle. Vaginal portion is not having any holes. Nipple portion of the cannula stays outside vagina and to be connected to the suction machine through tubing. Here I am showing two pictures. In figure 1, cannula is inserted into the uterine cavity up to fundus. Suction tube is connected to the cannula and then to the suction machine. In another picture, vacuum suction pump is used to create negative pressure inside the uterine cavity. This vacuum suction pump is available in every labor room, which is used for extraction of the head. This pump is useful in places where there is no power. These machines should have enough power to create a negative pressure of 650 millimeters mercury within 1 minute time. Coming to the concept behind vacuum retraction cannula, creating negative pressure inside the uterine cavity with a specially designed uterine cannula results in shrinking of uterus, which can assist the natural physiological process of contraction and retraction to stop atonic postpartum hemorrhage. Coming to the mechanism, how it acts, in this picture I'm showing, in figure 1, relaxed atonic uterus bleeding, cannula is inserted into the uterine cavity. When we apply negative pressure, the soft cervical tissues get sucked into the perforations of cervical portion of the cannula and the uterus becomes a closed cavity. Further application of negative pressure results in constriction, contraction, and retraction of uterus on the surface of the cannula, which assists the natural physiological process of contraction and retraction. Coming to the procedure in case of vaginal deliveries, initially, Foley's catheterization of bladder should be done. Blood clot should be expressed from the uterine cavity by bimanual compression. The uterine portion of the cannula should be inserted into the uterine cavity up to fundus. The outer end should be connected to the suction machine through tubing. Then we should insert fingers into the vagina and palpate the cannula and check whether any holes are remaining in the vagina. If that is the situation, you should gently push the cannula little up and see that all the holes should remain within the cervix. Coming to the fixation of the cannula, before application of negative pressure, the cannula should be held in position bimanually and then negative pressure should be applied. Cannula will get fixed in position within seconds. After inserting the cannula, when we apply negative pressure, the cannula will get fixed in this position. Coming to the procedure again, a negative pressure of 650 millimeters mercury should be created and maintained for 10 minutes. This procedure should be repeated every hour for 3 hours. After this, the cannula should be kept in the same position without removal and should watch for bleeding. In case of recurrence of bleeding, negative pressure should be applied by just switching on the machine. You can also take the help of 20 units pitocin drip, 60 drops per minute to assist the cannula to stop bleeding. Here I would like to show another video showing vacuum retraction of uterus for atonic postpartum hemorrhage during vaginal delivery. It's a case of atonic postpartum hemorrhage bleeding profusely. Vagina retracted with a wide blade speculum. We should catch the cervix with a sponge holder. Cannula is inserted into the uterine cavity. Tip of the cannula should reach the fundus. Tubing is connected. A negative pressure of 650 millimeters mercury should be created by putting on the machine. You can see the complete cessation of bleeding within 4 minutes after the initiation of procedure. Another method of inserting the cannula, when atonic postpartum hemorrhage is there, usually we explore the uterine cavity manually. When we do that, we should not remove the cannula from the uterus. Keeping the hand like that only, then take the guidance of the palm of the hand and insert the cannula up to the fundus. and then connect the outer end of the cannula with the tubing. Once uterus become contracted and retracted, cannula cannot be inserted. Coming to the removal of cannula, after the completion of the procedure, the cannula cannot be removed easily as the soft cervical tissues get sucked into the perforation of the cervical portion of the cannula and become adherent. These adhesions has to be gently removed by finger manipulation. After this, the cannula will come out easily. Coming to the vacuum retraction of uterus for atonic postpartum hemorrhage during cesarean delivery, one end of the suction tube should be firmly fixed to the nipple of the cannula. Other end should be inserted through the uterine wound and brought outside the vagina. By gentle manipulation, the cannula should be kept in proper position. Tip of the cannula should be at the level of fundus. Uterine wound should be quickly closed and then negative pressure should be applied. You can see the uterus getting sucked inside, resulting in firm contraction and retraction of uterus. Also, you can see the fine rugosities on the surface of uterus because of the contraction and firm retraction of uterus. In case of heavy bleeding, you can apply negative pressure even without closing the uterine wound after keeping the cut edges together and applying firm pressure with the wet mops. You can see the firm contraction and retraction of uterus resulting in cessation of bleeding. Also, you can see the blanching effect on the uterus because of the contraction and retraction. Advantage of vacuum retraction cannula: bleeding stops within 4 minutes after initiation of procedure. This procedure is simple and needs little time and minimal skills. As a negative pressure inside the uterine cavity is maintained in between suctions, uterus cannot relax and let loose the blood. As the blood circulation to uterus is not interfered, the uterotonic drugs continue to act and maintain the process of contraction and retraction. Blood collected in the uterine cavity gets sucked and collected into the suction bottle and helps to measure the blood loss accurately. This technique avoids laparotomy and other complex procedures to stop atonic bleeding and helps to save the mother and her fertility function in low resource settings. In conclusion, vacuum shrinking of uterus is a very effective physical method which can assist the natural physiological process of contraction and retraction to stop atonic postpartum hemorrhage. This simple, cost-effective, life-saving, and fertility-saving technique, which can avoid laparotomy, can be made available in any settings and can become the first defense against atonic postpartum hemorrhage. Thank you. Thank you very much for Docplexus. Coming to the question session, Dr. Jayashree Sudhir, please explain how cannula is used under low-dose isox fetal distress. This is two different questions mixed together. You should ask question only for cannula. Isoxaprine, low-dose isox is a different topic. Harish Deshpande, what is the significance of vacuum retraction cannula in the management of placenta previa, placenta accreta, percreta, and traumatic PPH? It's a very good question posted by Deshpande, but this is only the beginning of the story. We didn't have a case of accreta percreta were not used. And once it is widely used for atonic postpartum hemorrhage, I think people can use for this. In my published article, I mentioned about this. Coming to the Shanti, in Dr. Shanti, in which situation the cannula must be used? Can it be used after the onset of shock? What are the precautions to be followed? It's fine. Whenever atonic postpartum hemorrhage is there, you can use this. And when the patient is presenting in a shock, you can take the help of anesthetist. If the uterus is relaxed and cannula can be inserted easily, then you can use the cannula and they can start the resuscitation procedures. Kaushik Mukherjee, Dr. Kaushik Mukherjee, what are the long-term effects of ischemia on cervix and uterus due to vacuum effect? Actually, we are starting this now, and long-term effects we have to make further evaluation, not only by me, whoever uses it. Then, pancuricula. What is the importance of cannula in case of inherited coagulopathies? This is a good question, but I didn't have a case of inherited coagulopathies and I didn't use this cannula on that cases. But this has to be evaluated further by different studies. Coming to the Dr. Parvati Das, is there any possibility that this procedure may lead to future cervical incompetence? I don't think so, because it will not damage the cervix so badly, because we have given small holes on the cervical portion of the cannula. Soft cervical tissues get sucked there temporarily, and with minimal manipulation you can remove this. I don't think it will create a problem of cervical incompetence. Dr. Simpson, what are the contraindications for the use of vacuum retraction cannula? I don't think there is any contraindication. Bleeding itself is an indication for use of cannula. You can use it. Malati Madhu, Dr. Malati, while removal of the cannula after the bleeding stops, are there any precautions to be taken to prevent damage to the uterine wall and cervix? It's a very good question. Once we use the cannula for atonic postpartum hemorrhage, the cannula will not come easily because soft cervical tissues get entangled. And uterus becomes a closed cavity because of that only. But only thing what we need is, if you delay it, removal for some time, it comes out easily. And on the other hand, you may have to use gentle manipulation. You should not use a rough pressure on that. Sometimes it bleeds. So we should be careful and we should be very gently should remove it. Separate the additions from the perforations of the cervical portion of the cannula, then it works out. If the bleeding does not stop after 4 minutes of application of the cannula, what steps need to be taken? Do we continue application of longer duration to restart other measures? This is a good question. If the cannula works only for atonic postpartum hemorrhage, not for traumatic postpartum hemorrhage. But one advantage with cannula is cannula fixes the uterus. So you can pack the uterus. If the bleeding is not stopping, it must be a case of traumatic postpartum hemorrhage. In such case, you fix the cannula first, then pack the vagina with possibly if you can use vasopressin soaked mops, that's also good. It will stop bleeding. Dr. Kapil Patil, what is the duration of insertion of cannula and how can it be removed? Cannula can be inserted into the uterus within less than a minute time, and I have shown the video how to remove the cannula during my videos. Dr. S.K. Basu, is there any chance of a C-section scar getting entangled in the cannula as it happens with cervix? I have not come across a case like this, but you have to do, once people started using this cannula, you may have these complications. You may have to make assessment on these things. Thanks, Docplexus, viewers and everybody. I'm very much thankful to Docplexus, and I'm very much thankful all the people, 150,000 members of Docplexus for hearing me from this studio. Thank you very much.